The AEP for Medicare Advantage and Medicare Part D plans is every year from October 15th to December 7th. So depending upon when you're watching this video, plans are either available for preview or for enrollment. Now before we dive into the 2023 plans, please make sure to subscribe and of course click that like button. And regardless of what time of year it is, whether we're in the AEP or not, please feel free to contact us at iHealthBrokers with any Medicare related questions. Now, as a reminder, Medicare Advantage, also known as Medicare Part C or sometimes managed care plans, is actually a replacement for Original Medicare, which is Medicare Part A and Medicare Part B. So you'll still have access to at least all of the same benefits as Original Medicare. But very often Medicare Advantage plans offer additional benefits as well. These would be things like dental, vision, hearing, prescription drug coverage, and many more benefits. Now you may also have lower copays, lower deductibles, and you'll have an out-of-pocket maximum. However, this all comes at a cost. You will have to use in-network hospitals and in-network doctors. This is very different from Original Medicare, where you can just see or visit any doctor or hospital who accepts Medicare. Depending upon where you live and what your needs are, this can be a major sacrifice. We're also going to be talking about Medicare Part D plans. These are strictly prescription drug plans. So very often people purchase these in addition to Original Medicare and sometimes a Medicare supplement plan, because neither Original Medicare nor Medicare supplement plans, also known as Medigap plans, offer prescription drug coverage. Now, Medicare Part D can be a little confusing. So if you'd like more information, make sure to check out our channel for a video that does a deeper dive. But I'm just going to give you a quick overview of how Medicare Part D works. So basically, first you have to meet an out-of-pocket deductible. Basically, you'll be responsible for the full costs until you meet this deductible. And this maximum deductible is set every year by the government. However, your plan can choose to offer a deductible that's significantly less. Some plans even have a $0 deductible. Now in 2023, the max deductible is $505. And then you'll be responsible for copays or coinsurance. Now, as you're using your plan and Medicare are keeping track of your spending as you approach the initial coverage spending limit. In 2023, the max spending limit is $4,860. Now, once you've reached that limit, you're in stage 3. People used to refer to this as the donut hole. Again, your plan is keeping track of how much you spend as you reach the out-of-pocket maximum. And in 2023, the out-of-pocket maximum for any given plan is $7,400. If you reach that amount, you'd be considered to be in the catastrophic coverage phase. At that point, your copays or coinsurance would be significantly less. Okay, now that you have a general idea of how Medicare Advantage works and how Medicare Part D plans work, let's take a look at those 2023 plans. This is Medicare.gov. As you can see, open enrollment hasn't begun yet at the time of the filming of this video, so we're just going to click here where it says Preview 2023 Plans. So we're going to be looking at 2023 plans. It'll ask you for your zip code, and then it's going to ask you what type of plan. So you could look at a Medicare Advantage plan. That's what we talked about in the beginning of the video, Medicare Advantage, also known as Medicare Part C, also known as managed care plans. Or you could look at a drug plan, which are the Part D plans. Now, many Medicare Advantage plans actually offer prescription drug coverage. So if you are going to go the Medicare Advantage route, then you definitely want to take a look at those Medicare Advantage plans that offer prescription drugs. Now, if you're going to stick with Original Medicare, then you're going to want to look at a Part D plan. You may also want to look at a Part D plan plus a Medigap plan. Medigap plans are also known as Medicare supplement plans. The enrollment period is actually year-round. There is no specific enrollment period, although you are best served to enroll when you first become eligible in your IEP. That's the 6 months after you turn 65 and enroll in Medicare Part B, because during that time you will not be subject to medical underwriting. If you choose to enroll in a Medigap plan after your IEP, you may be subject to medical underwriting, which means you could be charged more or denied outright. You'll also have the option to just look at Medigap plans themselves, but that's not what we're going to focus on today. And then, of course, if you want to learn more, you can click down here and it'll just give you information. So let's start here with Medicare Advantage plans. Again, this little pop-up is just going to give you a little bit more information, which is basically what we were just talking about. It has with or without drug coverage, and then very often it offers additional benefits. If you are eligible for Medicaid and you're also eligible for Medicare, you are what's known as dually eligible. That means you can enroll in a DSNP, which is a dual eligibility special needs plans. These are a type of Medicare Advantage plan, and they encapsulate all of the benefits of Medicaid, plus Medicare, and many additional benefits as well. So if you do get help with your costs from any one of these programs, of course you're going to want to click on that. If you're not sure, you click I'm not sure, but we're going to click on I don't get help from any of these programs. Just as a side note, if you are going for a DSNP, you should know that there are many more DSNPs available this year than there have been in years past. Do you want to see your drug costs when you compare plans? So this is a good thing to do, but I would caution you to take this with a grain of salt because there are many different variables that can come into play here and things can change. So it is helpful to get a general idea of what your prescriptions may cost, but just remember that things can change. So let's say yes. It's going to ask me for some information. So I'm going to put in Lipitor because that is a pretty common cholesterol medication that many people, especially as we age, tend to take. So let's add the generic because that is going to be less expensive. I'm just going to keep this as it is. Now, of course, if it was different, you change it, but we're just getting a general idea. So that's it for right now. Okay, we're going to keep the zip code that we put in. And now here are the pharmacies. So these are the pharmacies that, based on the zip code that I had put in earlier, these are the pharmacies that are showing up as the closest. There's, of course, a mail order pharmacy, and then there's several of these pharmacies here. Now, I would encourage you to include a mail order pharmacy as an option because you do want to be able to compare the prices. Very often the prices of the brick and mortar pharmacies are going to be pretty similar as long as they're both in network, but you may notice a difference in the mail order pharmacy. However, you do want to go ahead and click any of the pharmacies that you are most likely to frequent. That way you can get an idea of costs. And also, if you choose that plan, it's good to know which of the pharmacies are going to save you the most money. So let's click on all of these. You can do up to 1, 2, 3, 4, 5 if you so choose. So let's see. Oh, interesting. Let's also put in Publix. And we'll add this just for good measure. Done. And here we go. So this is all of the plans that are available to me in the zip code that I put in as far as Medicare Advantage. So right now it is sorting plans by lowest drug and premium cost. So that's basically your general monthly cost. You will notice that many of the monthly premiums here say $0, but please take a look at this. Doesn't include the $164.90 standard Part B premium. This is very, very important because many Medicare Advantage plans advertise themselves as free. They are not free. At the very least, you still need to pay for Part B, so there is still some type of monthly charge. So let's take a look over here. So just to give you a general rundown of how the website works. So you have the name of the plan, the star rating, the monthly premium, which is of course how much you pay on a monthly basis to keep your insurance active. And that's telling you it's including health and drug coverage. Here's also the yearly drug and premium cost. So there's no additional cost there, probably because we put in a generic drug. And any other costs. There is a $0 health deductible. So remember, the deductible is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share. So you can actually utilize this plan without having to meet a deductible. And then there is a $0 drug deductible. So some plans will have a separate drug deductible, which means you would have to pay out of pocket for your prescriptions. This plan doesn't have that. We talked about that earlier when I was giving you a basic rundown of Medicare Part D, that there is a deductible, but that some plans offer a lower deductible. And here is the out-of-pocket maximum. This is a $1,000 out-of-pocket maximum. So should you need medical care and the bills come in at more than $1,000, your insurance carrier will take on the remainder of the costs. However, that is in network. Very, very important. We'll also see here that this is an HMO. Again, very, very important. An HMO is a health maintenance organization. That means that you must have a primary care doctor. That means that you can only see doctors and utilize hospitals that are in network. And if you would like to see a specialist, you need a referral from your primary care physician or PCP. Over here on the right-hand side, you'll see the benefits that are offered. Now, this is just a basic little screenshot of the most common benefits offered by Medicare Advantage. There are additional benefits that many Medicare Advantage plans offer. For example, there's something like Papa Pals. That's not going to be indicated necessarily on this portion of the screen because these are just the more common benefits. But if you were to delve deeper into the plan's benefits, into the summary of benefits, you might see some additional benefits offered. So you'll see here this plan offers vision, dental, hearing, transportation, fitness benefits, worldwide emergency, telehealth. It also offers benefits regarding over-the-counter drugs and in-home support, but it doesn't offer home safety devices and modifications or emergency response devices. Now let's scroll down, and then of course it also offers drug coverage, which we already mentioned. Let's scroll down. So here's another plan. This one also has 5 stars. It's also an HMO, a $0 health and drug monthly premium, $0 deductible, $0 drug deductible, and a $1,900 in-network out-of-pocket max. Here's the benefits if we click on this. So basically things are looking pretty similar, except I will mention that this has a $0 copay for your PCP, a $15 copay for your specialist. This plan had a $0 copay for your specialist. This is another HMO. You can compare the different snapshots, basically, of the benefits here. And you could, of course, just continue to scroll through and get a general idea like this. Let's go back up to the top. Here you can filter by a couple of different things. So let's say there's benefits that are very, very important to you. Let's say, for example, that dental coverage is very, very important to you. Remember, Original Medicare does not offer dental, but that's not necessarily a bad thing. Dental insurance, private dental insurance, is readily available, and it is nowhere near as expensive as many people think. So do remember, if you're going with an HMO for dental, it's highly likely it's going to be a DHMO, which means that you're going to be very limited in the dentist that you can choose. But let's say that was very important to you, that you wanted to ensure that you had dental coverage. So we've just applied that filter. So now all of the plans that we look at are going to offer dental coverage. Now let's look at insurance carrier. That's very important with Medicare Advantage plans. Remember, with Medicare Advantage, you need to operate in network, because if your doctor or hospital doesn't accept your plan and you're on an HMO, then you would have to pay entirely out of pocket. That's not the case with a Medicare supplement plan. With a Medicare supplement plan, there will also be carriers because Medicare supplement plans are offered by private carriers. However, if your doctor accepts Original Medicare, they accept your supplement plan regardless of who your carrier is. So again, Medicare Advantage, carrier, very important. Medicare supplement plan, carrier, not so much important. So let's say you have a particular specialist that you have to see and they only take Aetna. Well, let's click Aetna so that way we can see what plans are offered. And here you go. So here would be an Aetna plan that you could choose to make sure that you can still see your specialist. And here's another Aetna plan and another Aetna plan. So what you can do at this point is you can pick a few plans to compare more in depth. So let's say we'd like to look at this plan and this plan because it's a PPO. Remember, a PPO will allow you to go out of network. And this plan. So now we have the three plans that are of most interest to us all on one page where we can easily compare them. We've got the Aetna Medicare Select, which is an HMO, the Aetna Medicare Premier Plus, which is a PPO, and the Aetna Medicare Eagle, which is a PPO. So let's scroll down. So this plan has a 4-star rating, a 3.5, and a 3.5. These plans all have a $0 health deductible. This plan has a $0 drug deductible. This plan has $150, so you would need to pay for $150 worth of your prescriptions before your insurance begins to contribute to the cost share, and then you're responsible for copays or coinsurance. And this plan also has a $0 drug deductible. This plan has a $2,500 out-of-pocket maximum. That's only in network. Now, these plans are both PPOs, which means you can receive coverage in and out of network. They both have an $8,950 in and out of network out-of-pocket max. And then there's that $4,500 in-network max. There's no monthly premium aside from the continuance of paying for your Medicare Part B. There's no monthly premium for your drug coverage. But you do still have to pay for Medicare Part B, which I mentioned. And now we can see a comparison of the benefits. So all three plans offer vision, they all offer dental, they all offer hearing. 2 of the plans offer transportation. This plan does not offer transportation. They all offer fitness benefits and worldwide emergency and over-the-counter drug benefits. None of them offer in-home support services, and only this first plan, the HMO, offers routine chiropractic services. None of the plans offer home and bathroom safety devices. The HMO and the Eagle plan offer meals. All three offer your annual physical exams, of course, telehealth, which was up in the air, but now it seems that Medicare is going to continue to cover telehealth. Endodontics, periodontics, extractions, and now you can click here for additional benefits. Now this is going to take you to the summary of benefits, which is going to give you a more in-depth view. So if we were to look here are the extra benefits. So for hearing, a $0 copay. It's always important to look at these limits here. There may be limits on how much the plan will provide. Preventative dental, oral exams, cleaning, dental x-rays. Generally speaking, the x-rays are limited as to how frequently you can get x-rays done. For all of these services, there's a $0 copay. For vision, the eyeglass frames wouldn't be covered. We're going to see some more benefits. Chiropractic services, acupuncture are alternative therapies. There's even some health education, no counseling services, some coverage for fitness benefits, and then some special benefits, food and produce. So sometimes you'll get a certain amount of money that can be used at certain stores for food and produce. Again, we're back to where we can compare. Scrolling down. So if we wanted to look here, we would do the same thing for additional benefits. Now let's compare the benefits and costs. So this is our HMO, $0 copay in network, nothing covered out of network. For these two plans, $0 copay for in-network, $55 copay for out-of-network. This is basically how PPOs work, is that you have in-network coverage and out-of-network coverage, but if you choose to go in-network, it's usually much less expensive. For a specialist, $0 copay must be in-network, $35.65, $40.70. Then we have diagnostic tests and procedures. It's going to depend upon the test and procedure. It can range between 0 to 25. For this, it'll be 0 to 20 and a 50% coinsurance. A copay is a set amount. Coinsurance is a percentage of the cost. And then if we were to scroll down, again, you're going to see the additional costs. And then here are some of those benefits, the extra benefits that we mentioned earlier. So $0 copay, and now drug coverage. So these were the pharmacies that we put in earlier. So let's take a look. So we had put in that generic version of Lipitor. So let's take a look at what this says. So at Walgreens, $180 compared to Walmart, $0. So this is why it's helpful to do this, because if you're looking now and it's just as convenient for you to go to Walmart as it is to go to Walgreens, you're definitely going to want to go to Walmart instead. It looks like that orthopedic specialists is out of network, so it would be very expensive to try to fill your prescription there. And then, of course, there's Publix or the mail order pharmacy. This is very similar in both of these plans. This plan, the PPO, did not offer prescription drug coverage. So probably not the best plan to choose unless this plan really suits some other specific medical needs that you have, and there's a strong incentive for you to choose this plan over a plan that offers prescription drug coverage. You can always get a separate Part D plan if needed, and many of the Part D plans are rather inexpensive. So generally speaking, with Medicare Advantage, you're going to go with a plan that offers prescription drug coverage unless there are special circumstances that really incentivize you to choose a plan that doesn't offer prescription drug coverage. But that is a rarer occasion. Now I just want to discuss special needs plans quickly. So first, there are C-SNPs. These are plans for people who have chronic or disabling conditions. There's a very long list of conditions that would make you qualify for a C-SNP. So you can see here things like stroke, cancer, dementia, end-stage renal disease is another one, organ transplant is another one. There's a very, very long list, and I will put a link at the end of the video. Basically, these plans are tailored to meet the needs of that condition. So for somebody with diabetes, a plan might have lower costs for a podiatrist or insulin. For someone with heart failure, it might have lower costs for pulmonologists or cardiologists. So if you are someone with one of these conditions, you might want to consider it, but I'd highly recommend that you work with a broker, especially for a C-SNP. And then there are D-SNPs, which are plans for people who have both Medicare and Medicaid. Again, those will encapsulate the benefits of Medicaid plus Medicare and many additional benefits as well, usually at a much lower cost. Now, right now, these are sorted by lowest drug and premium cost. You could also, of course, sort it by your yearly drug deductible, your health plan deductible, or just the lowest monthly premium by itself, not taking into consideration the drug costs. So now let's take a look at Part D plans. We're doing the same thing again, just putting in a zip code, put in that you're looking at a Part D plan, apply, and let's take a look. Same questions that it asked before. Extra Help, by the way, is a program that will help you to pay for Medicare Part D. It's based on your income. So I'm going to put I don't get any help from any of these programs. It's just kept the drug that we put in before. So we're going to say done. It's again asking us for our pharmacies, so for comparison's sake, let's do the same ones that we did before. There we go. And this is sorting by lowest drug and premium cost. So this plan at face value would appear to be the least expensive option. So the monthly premium is $8.40. and at a retail pharmacy, it's estimated that based on the drug information that we put in, our yearly costs for a retail pharmacy would be $124.80, and the costs at a mail order pharmacy would be $123.16. This is just an estimate. There is a drug deductible here. It's $505. Now you can see here that it's not going to tell you the benefits on the right-hand side of the screen because it's just prescription drugs, but it will tell you about the pharmacies that you put in. So of the pharmacies that we put in, 2 of the 4 retail pharmacies, plus the mail order pharmacy, would be in network. So let's scroll down. This plan's monthly premium is $11.20, and the estimated yearly costs are $134.40. And 3 of the selected retail pharmacies are in network. So as you can see, Part D plans are not terribly expensive. Now these are going to continue to increase, of course, as we go up because that's how it's sorting, but this gives you a general idea. So we're going to compare 3 of these. I'm going to compare 3 very different ones. And let's see. So let's compare them. The name of the plan and the monthly premium. Here's the star rating, again, the monthly premium, the deductible. So we only put in 1 prescription drug. Let's say that I put in a prescription drug that was more specialized. Well, you might see here that perhaps one of these plans wouldn't cover it. If that's the case, probably not the ideal plan for you. So this plan is the least expensive, but Walgreens is not in network. However, Walmart, Publix, and the mail order pharmacy all are. So it still gives me plenty of options. Now, Walgreens is covered at these 2 plans. However, it's significantly more expensive than Walmart, as well as the mail order pharmacy. Sometimes you will notice on a plan that one of the pharmacies is much less expensive. Sometimes you'll notice the mail order pharmacy is much, much less expensive. Of course, that can be a little bit inconvenient for people. Let's take a look at the plan details. So here's our monthly premium. Here is the drug deductible. Here are the pharmacies that we put in. Now, if you want to learn a little bit more, just scroll down here. So these are the 5 tiers of medication. There is preferred generic, generic, preferred brand, non-preferred drug or non-preferred brand, and specialty tier. Each of these has an associated cost during the initial coverage phase, during the gap coverage phase, which is the donut hole, and during the catastrophic coverage phase. Now, preferred generic will always be your least expensive option, and specialty tier will always be your most expensive option. So a preferred generic would be $2, a generic $15, a preferred brand 25%, a non-preferred drug or non-preferred brand 50%, and a specialty tier 25%. These amounts change when you're in the coverage gap. Then it's up to 25% basically for any of the tiers of the medication, but specialty tier medication tends to be the most expensive. And then when you're in the catastrophic coverage phase, it's up to $4.15 or up to 5%, whichever costs more for generic, and up to $10.35 or 5%, whichever costs more for brand name. And you can see here, it's tier 1, which is why it is the least expensive option. And the reason this here says chemotherapy and other Part B drugs are not covered is because that is covered by Medicare Part B. Chemotherapy and other Part B drugs are covered by Medicare Part B, not by Medicare Part D. As always, if you need assistance with your plan or if you have any questions whatsoever, please feel free to reach us at the number on the screen. And of course, you can always reach us in the comments below, and we are more than happy to help. And as I said earlier, do make sure to subscribe because we release these videos on a weekly basis. And of course, make sure to click that like, give us a thumbs up so we can get this information out there. Thank you so much for watching and you have a wonderful day. Bye-bye.